So now I'm going to talk to you a little bit about clinical care for the virus. Let's talk first about clinical presentation. COVID-19 looks like many other viral respiratory illnesses. It doesn't look too different from the standard flu and other viruses. But in a study in Wuhan of 138 patients, initial symptoms were pretty interesting. They had fever in about 99%. That number is misleading because there were about 44% of patients that had it on admission, although 90% or more experienced a fever at some point during hospitalization. So you may not have a fever as your first symptom, but most patients will get a fever during the course of the disease. There's a fatigue in 70%, a dry cough in 59% of patients, not all, anorexia or the inability to eat in around 40% of patients, myalgia in 35%, dyspnea in 35%, so muscle aches and pains and shortness of breath, and sputum production around 27%. So earlier reports said that there were digestive symptoms, including diarrhea. That may be a symptom in many cases, although early they were saying it was around 50% of cases. Those numbers may be much lower. However, patients that do present with GI symptoms may be at risk for a worse form of the disease. So that's important to note. Contrary to all those reports, about GI symptoms, we found that many patients that are presenting with GI symptoms may not necessarily ascribe it to their viral illness and may dissociate those two symptoms. Patients may also experience a runny nose and a sore throat, as well as, importantly, the loss of smell or the loss of taste. Those two findings, again, were reiterated this week as important by the American Academy of Otolaryngology, and I think that those will help us to differentiate clinical cases, patients that are presenting early to the hospital.